SAGES Stories.
Welcome to today's episode of SAGES Stories, the official podcast of SAGES, the Society of American Gastrointestinal and Endoscopic Surgeons. Please make sure to hit the like button and subscribe so you can stay up to date with our most recent episode. And enjoy the show.
So welcome to episode 28 of SAGES Stories, where we shine the light on some of SAGES' most impactful leaders. I'm your co-host, Dr. Kevin El-Hayek from Cleveland, Ohio.
Hello, everyone. I'm Dr. Jenny Shao, and I'm coming to you from Ann Arbor, Michigan.
And I know I've mentioned this before in previous seasons, but we are in my favorite time of year here in the Midwest when all the leaves are changing colors outside. I'm sure it's the same for you up in Michigan, Jenny.
Yes, absolutely. It's definitely one of the hidden secrets of living in this part of the country. Unfortunately, it's usually short-lived, but this year I'm a little surprised. It's been a little warmer than usual. Even with Halloween around the corner, it still feels warm. Usually I feel like I'm freezing in my Halloween costume, but hopefully this year the weather will hold off.
Yeah, there's something about it staying a little warmer, but I think winter is coming for sure when we hit Halloween. And I'm sure this episode will drop at the same time the temperatures do for both of us. And I'm sure also that this episode will warm a lot of hearts because today we get the opportunity to talk to Dr. James Rosser, a minimally invasive surgeon who has played critical roles in both innovation and medical education. Dr. Rosser, who many of us know as Butch, is currently clinical professor of surgery at the University of Central Florida and University of Buffalo Schools of Medicine. Most recently, he is chief of surgery and director of the Center for the Advanced Treatment of Heartburn at Gila Regional Health Center in Silver City, New Mexico. Dr. Rosser has had an illustrious journey in surgery, one that we will certainly unpack a little of today. But suffice to say that he's been at the forefront of minimally invasive surgery for well over 30 years. We can't wait to hear your story, Butch.
Guys, I want to thank you all for having me. And, it's always nice having someone else interview. I got interviewed by the Smithsonian, and you never realize what you've done until someone else pulls it out of you. So I'm excited to see what you guys pull out of me today.
Yeah. We're good surgeons. We pull a lot of stuff out of people. So me more than Jenny. Jenny closes what people have pulled out, but she takes some stuff out too. She does some general surgery.
I love it. Well, I guess to start, we always like to hear a little bit about our guests in their own words. Can you tell us a little bit about yourself? Where did you grow up? And what were some key moments along your journey so far?
Well, I was born in Rome, Mississippi. And so I always get people on that. I always get people on that.
All right.
And I was born
Rome, Indiana, because I'm sure that also exists.
Yeah. And it was born in a tough time in our country, where I could not, walk in hand or my arm around your shoulder, Kevin, his friends down the street without being threatened to be lynched. I definitely couldn't look at Jenny and say anything. But out of that turbulent time, I had parents who, well, my dad had fought in World War II and at Iwo Jima and come back, and similar to a lot of other African Americans, came back to the indignities of this country, but loved this country in spite of its blemishes, and went to school on the GI Bill, got his master's degree, built a school in Mississippi that I had the misfortune of going to because it was named after him and he was still alive.
Wow.
So
what was it called?
James C. Rosser Senior Elementary School in
Moorhead, wow.
Mississippi.
Wow.
And so he was harder on me. But out of all of that, I got instilled within my soul that I was not achieving for just me, but I had the burden of an entire race on my shoulder because that was a dark time in this country during Jim Crow. And I'm glad my father helped me to mature an attitude that the cup was half full rather than half empty, and grew up just just believing in this nation and believing people like Martin Luther King and Fannie Lou Hamer, who I had the great fortune to meet right before she had her famous speech at the 1964 Democratic Convention, when the Democratic Party that it featured African Americans was shut out of the Democratic Convention. And those are the kind of people that inspired me. I always had academics and helping people as a cornerstone of my existence based on my parents and grandparents who had a very illustrious military career. They went all the way back to the Buffalo Soldiers. And I happened to be practicing in the shadow of the Buffalo Soldiers Fort Baird. And it's interesting when I walk out there and work out amongst the cemeteries, I feel my ancestors there. And
Where is
then,
that? Where is that cemetery? Where is that
yeah,
now?
it's in Fort Bayard, New Mexico, which is
Wow.
5 miles away from my home
Okay.
right
Oh
now,
my gosh.
about 7,000 feet above
Jeez.
sea level. And I had it, and I didn't know I was coming in a way home to my relatives, you know.
Mm, mm.
Um, and subsequently, I came up with that kind of joyful attitude in the midst of darkness. And and I was accelerated. I actually, graduated high school at 16, and I played football. But I played football for fun. I didn't want to go to the pros, but I got 100 scholarships. I wanted to go to University of Mississippi, um, undergrad in Oxford, but Johnny Vaught, was man enough to tell me to his face that they weren't ready for black players yet. So I wound up signing at the University of Florida, walked on their campus at age 16. Instantly, I was struggling, because my heart wasn't there. And a year passed, and that's when my fraternity brothers, Omega Psi Phi fraternity brothers, Ben Williams and James Reed, they were the first blacks to integrate the University of Mississippi's medical school. That's when I came back. And then I set out, we had to set out 2 years then. And I love coming back there, faced a lot of hardship. I'm
So,
going to take a,
so when did you, so you had to sit out 2 years before
yeah,
starting?
you could not do what they're doing now. Like, switch
Oh,
teams, you had a
okay.
penalty of having to sit out and forfeit
Oh,
2 years.
okay. Okay.
So I was there, still practicing everything like that. But, I was in pre-med. Now, I have to share this story, which that involves another giant in SAGES. You know Mike Brunt, of course, right?
Of course.
Yeah.
I will forever love Mike Brunt
Oh, that's
because
awesome.
he was the only person that would speak to me in our
Hmm.
chemistry class or organic chemistry class. He was in the band.
Wow.
Wait, did you
And
guys go to college together? I didn't know that.
yes,
That's
Mike Brunt
amazing.
knows me longer than anybody else in
Wow.
SAGES because I
Wow. See,
met
that's
Mike at 16 or
that's
17.
We're
16 or
gonna have to
7.
hear some dirt on Dr. Brunt here now that we know this secret. We're gonna have to
Wow.
Yeah.
share
So
some
you've known
stories.
him since you guys were teenagers.
Yes, yes. That's
Oh
how
boy.
far he and I go back. And we,
Not that it's that long ago. I mean, you
no,
guys
it
are,
is long
yeah.
ago. I could be both you all's dads.
Mm,
So what happened then is I have to say that because when I was inducted to the Hall of Fame of the University of Mississippi and riding that parade, the number one thing that came into my mind in the midst of all the things that come into my mind that I wish Mike Brunt was there to see me because he was the only one that would acknowledge my presence.
I mean, I think that's a very important message to everyone listening, to my kids, to myself. You you know there, and I definitely probably one of the people that could get this lesson more than others about just looking for an opportunity to show kindness. It
Yes.
does not take a lot, and it can impact someone decades later, and
Yeah.
be thinking, like, to be thinking about that during this moment when you're being brought up as Hall of Fame, all the joy of that, and just remembering this little guy. I'm sure you guys were both, he might have been little, you were not,
No,
probably.
yeah,
You
he
were,
was Mike was tiny,
he's a tiny guy.
I
You're
looked
this.
like a baby.
Yeah. And I'm a little guy, so I can recognize, and just to have this memory is truly, I mean, that's spectacular image. That
Well,
is a
look,
spectacular
it's
image.
those kind of memories, Kevin, and I'll never forget you. My oldest son is named Kevin.
Oh,
Um,
nice, good choice.
yes, exactly. Those are the things in life that actually add substance to your life. They're things that God puts in your path that fuels you. That act of kindness generated enough kindness for all the people who would not share that.
Mm.
And it helped
Hmm.
me get through a very tough time.
Mm.
And so uh, I went through pre-med and did well. And I actually had to make a decision at that particular point in time. Do I go and stay there at Ole Miss and play football and be a grad student, and that sort of thing? Or at 19, I had a chance to go to medical school. And so I really think my parents were grounding me to make a decision that was the best decision. And once again, harrowing back to that Hall of Fame day in front of 60,000 people, I was in the Hall of Fame not because I played football, but because of my contributions globally. So that I went through the University of Mississippi and learned so many things. Then I went to, I decided, and I have to tell you this story. There's a lot of Butch Ross's stories, but here's one. So I'm a senior medical student, and there'd never
And
been a
where were
black
you? Where did you go to med?
University of Mississippi.
So you stayed an
Yeah,
undergrad. Okay, okay,
I went down to the University of Mississippi Medical School from the undergrad school, and I was
got
like
it.
the second person of color, third person of color to do that.
Wow.
And it was a time where the surgery department had no uh, faces of color, and so I was, they were impressed with me, and I was much bigger. See, you don't know me when I was 6'4", 460 pounds. That's another story we'll get to. But at that particular point in time, I thought I wanted to be a family practitioner, but I said, no, I think I like this surgery thing. So I went to the assistant chairman, whose name was Gus Neely. He flew P-38s during World War II. I mean, he was the head of trauma. Uh, he was infamous for having the front of his Mercedes trigger the electric door to open the trauma bay. That's
Oh
how
my gosh.
that's how rambunctious he was. And he's the one that actually I hope you all still can see me.
Yeah,
He's
Yeah.
the
yeah, we can still see you.
Yeah, he's the one that said, you know what? You're a big old rascal, but you got great hands and that. I said, well, Dr. Neely, I really don't know. He said, look, you should go and talk to Dr. Hardy. Now, this is Big Jim Hardy, the first heart transplant Hardy textbook of surgery Hardy. These are the giants that I was in the shadow of. And also Arthur C. Guyton. Arthur C. Guyton was my physiology instructor of Guyton Physiology, Guytonian Physiology.
Wow.
So I walk in, I get the courage to walk into Dr. Hardy's office. And then I said, Dr. Hardy, I talked to Dr. Neely, and he said I may have a future in surgery. He said, yeah, I believe that, but you've done a great job for us. I said, well, I have some, reservations. He said, what's that? And I said, well, don't you have to be an asshole to be a surgeon? He reared back with the
Wow.
biggest laugh. And then he said, well, Butch, I'm here to tell you that being an asshole is a personal decision.
Oh
But
gosh.
if you're asking me, I think you have the capability to do that. Well, I wanted to actually go to the University of Mississippi surgical, residency,
Residency.
but I matched at what was my second place, and that was Akron General Medical Center in Akron, Ohio. And
Oh, wow.
they had and they had something innovative, a European 6-year medical school. In other words,
Ah,
from high school, you went to medical
yeah.
school, and then
Yeah,
you graduated.
Neomed.
Yeah, exactly.
Well, it's Neo
Yeah,
UCOM
right.
at
That's
that
the
time.
original. They
So
changed it
yeah,
now.
that's
Now,
right. Neo
Kevin, you're
UCOM.
right there in the shadows
Yeah.
of
Well,
it,
yeah. Well, my dad is surgeon in Youngstown, and that he was faculty at Neo UConn. So
Okay, yeah. So I went there, and oh my God, I was really glad I went there because I met my mentor that would shape my life the rest of the way, and his name was oh God, I drew a blank. All right, but his name was
it's okay.
Herbert Auerner. Now, Dr.
Herbert
Auerner
Allen.
had an interesting background,
And so
and
that
you
was
may have heard of his
residency.
son.
Yeah,
He
that
has a
name sounds
son
familiar.
that practices in Akron. But let me
Okay.
tell you about Dr. Auerner. He was GYN and general surgery trained in Europe and had to come over here and redo his general surgery residency. So guess what I got a chance to do as a first year? 19-year-old girl comes in right lower quadrant pain.
At
Her
laparoscopic
cycle
appendix.
was kind of, it wasn't a good story about where she was in her cycle. I am first year resident. I go down. I say, call Dr. Allen. Yes, Dr. Allen, we have a 19-year-old that has this, right lower quadrant pain. She has appendicitis. Sir, I'm getting an OR and ready for you. He said, wait, young one, just wait. It's typical European gentleman. Unbelievable. He said, I know you want to operate on her, but what operation are you going to do? Well, of course, I'm going to do a McBurney incision and do an appendectomy. He said, well, that would be your first inclination, but there's something else. And okay, I'm flustered now. What else? We could do a diagnostic laparoscopy. I said, you mean that pseudo surgery that the GYN people do? Well, I know you're from the South, but I've not quite heard it elucidated, talk spoken that way about, it's classic European gentleman.
Yeah.
We go in, Jenny, I do a diagnostic laparoscopy as my first case with Dr. Herbert Auerter, and guess what this young lady had? An
Appendicitis.
ovarian cyst that was
An
torn.
ovarian cyst, a
Yeah.
torsion. Wow.
So then I think I'm exonerated. Oh, now we're going to open her. Oh, no. No, we're not going to open her. Ovarian aspiration needle, got all the fluid out, detorsed her, and the girl went home the next day. That changed my life.
So what year was that?
That was 1981.
Wow.
1981.
That's
So,
So
yeah.
that was so you were an intern. Okay, so I honestly 30 miles down the road, my father was a third year resident at Youngstown at the time.
Ah,
So in 1981. So this is around that time too that this was going on. So you did your residency at Akron General then? Was it Akron General?
Akron General
Yeah.
Medical Center, now part of the
Okay.
Cleveland Clinic
Cleveland Clinic. Yeah. Yeah.
system. And so that started my journey in laparoscopy way before other general surgeons even touched it. So in 1986, they asked me to stay, and I was assistant professor of anatomy and surgery there at New UCOM and also at Akron General. And Dr. Auerner told me he was going to Europe, back home, but he was going to go to this conference because he was going to see how these gallbladders were going to be removed with laparoscopy.
So that was
Oh my God,
86.
that
That was
was circa
86, right? Yeah.
1887, 86,
87,
87.
86, 87. Yeah.
Oh my God, he came back and he was always on the cutting edge, but that made us kickstart and do one of the first laparoscopic gallbladders in the country.
Wow.
That's what we
Wow.
were
And
going to ask you about, actually. It's just your pioneer role in early minimally invasive surgery. And it sounds like you were probably one of the first people in the country to perform some of these cholecystectomies and common bile duct explorations. I mean, we would
yeah,
just love to hear
exactly.
some
And
insight.
but Jenny, you see why? Because of my background, I was blessed to be there with this unbelievable gentleman. So then I'll never forget when we did our first one. I mean, people were hanging from the rafters. There were reporters, and the plain dealer the next day.
A Cleveland
That we
magazine or a Cleveland newspaper for those who
Oh yeah,
don't know
forgive
the
me.
area.
Yeah, yeah.
Yeah.
It's one of the biggest newspaper there in Cleveland.
Yeah.
So it says, we saw the future of surgery. Uh, Dr. Butch Rosser, the Nintendo surgeon. Now, the reason they said that is because they asked me, you look so natural doing this. Why is that? I said, there's two reasons. I fly radio control airplanes and I play video games. So they
I
had
love
the
that you
thing.
said that.
They came out with the headline, the
The
Nintendo
Nintendo
surgeon, and
surgeon.
yeah, later on became the
Wow.
Xbox doc, etc.
Oh,
So
wow.
then that
Wow.
started it all. So because of my experience, Carl Zucker, and you can go to the Zucker textbook, one of the first textbooks in advanced laparoscopic surgery. I was on my way to Paris to work with Francois Dubois
Dubois.
and to work with Professor Dubois in Paris. Because then I said, okay, I found my calling. This is how I'm going to make my mark in surgery. So I got a call. They had to page me in Cleveland Airport. I mean, overhead. That's how ancient it was. And it was Carl Zucker. And he asked me to come to the University of Michigan to talk about laparoscopic appendectomy and cholecystectomy. And
Wow.
Jenny, right at
I
UM,
love that.
that's where I got my first big, break into it. And then after that, I took off around the world with this. The other thing that distinguished me is that I was in the Guinness Book for a short time with the youngest gallbladder removal laparoscopically in a patient 15 months old. I was
Oh,
on the. I had to redesign the whole operation because the new peritoneum had to be lower. I had to come up with a new open technique that I published. Harry Hassan of the Hassan technique. That was my good friend, and I modified his technique, and we were able to get that done safely. Then I started doing the common bile duct operations. Did that in the youngest series of kids, 8, 10, and 12 with sickle cell. Then I started publishing, and this brings us up to SAGES. Of course, Dr. Allen was one of the first members in SAGES, and he said, "You got to join SAGES," and I did. And SAGES really boosted my ego and confidence because the thing I tackled was because I was a professor of anatomy, to go back and do cadaver dissections that featured the inguinal region from the laparoscopic point of view. And not only did I do the paper and it was published, but I won first place at SAGES. And for
Where
that,
was that?
that was in 1993.
93.
And
Wow.
93.
so that made me fall in love with SAGES, fall in love with. I said, okay, this is my destiny, and that's what started it. And then subsequently, I said, wow, I love teaching, so I'm going to concentrate on teaching. And
So I'm
so,
gonna you're firing through all of our questions. So we're not gonna you go by yourself in many respects, but I'm gonna stop you at that because
yeah, please stop me, please.
I want to find out. We have a couple questions specifically
Yeah,
as we looked at your CV and kind of. I mean, we could unpack you for probably about you could make up like multiple episodes, just each of your facets. But let's stop
yeah.
on the teaching because you're about to talk about it anyway. But I just want to know, obviously you were really impacted as a trainee very early on in your intern year. It kind of jump started your career as a clinician, and it certainly affected your clinical interest. But then you really have played huge role in medical education, specifically surgical education. And I mean, you could talk about all the various training platforms, maybe pick one or two. How do you see the role of educators in surgery evolving? And then what changes did you kind of add to that in terms of your teaching approach? And we know you've started things like mini med school at SAGES and various things like that. So let's maybe unpack that for a little bit.
Well, the key, I thought that the portal to the future of advanced minimally invasive surgery was intracorporeal suturing. I felt that was the hurdle that we had to get over. The paper came out that said, doing this on your own would take about 350 hours to be proficient. So I set my sight on, my goal was to carve that down to 8 to 12 hours. So that's when I, went around the world to the great masters who could suture, but couldn't tell you how to suture. They only told you to practice. So being in aviation and with NASA eventually, and a fan of Top Gun, I knew they had a similar problem. How do you train a great fighter pilot? So I went to Top Gun and I looked at what they were doing, how they train, and I subsequently did two things. Number one, I developed an algorithm that if you perform this algorithm, you could do this efficiently. And I developed the preparatory partial tasks to help you get up to speed and execute the algorithm. And I started a database that could let you have a surgeon's report card and compare yourself to eventually the 10,000 surgeons that have done this around the world. That was my big thing.
So data, I mean, in a way, getting some data.
Aviation and aerospace, transferring those training dictums over to surgery, and data so that you got graded. And that was the evolution of Top Gun. Being able to do this, started publishing on it, and all this sort of thing. So the journey started there. I'm going to be able to help people to more effectively get up to speed.
How did
So
you
that
figure out
go
this
ahead.
ties to aviation? It feels like such unrelated fields. Was that something that you had just known, or how did you connect those dots?
Well, frankly, there was a lot of resistance. But as I was inside Top Gun and broke down how they did what we need to do, how do you define a great surgeon? How do you objectify, a seemingly unobjectifiable, target? And I saw how they did it. I saw how they broke things down. I saw how they got data on every particular component. I saw how they progressed in fidelity, from low fidelity to high fidelity. This is all what they've done. I saw how they use trainers, how they use simulators, and that's what connected the dots, the simulators. They didn't let you get into, at the time, a F4 Phantom or A4 Skyhawk. You had to go through the simulators. And I look at Jimmy Doolittle, how he helped revolutionize flying at night with a simulator. So let's go to simulators. And that's when I designed the Top Gun simulator, and United States Surgical, Covidian at the time, bought 50 of them and sent them around the world. And he sent all the data back to me. Now, at the same time, at McGill, their group was doing their thing, which is, of course, FLS.
Yeah, FLS.
And everybody thought that we clashed. No, Top Gun is intracorporeal suturing specific, whereas FLS in its current and state and in the beginning, it was very, very basic. Top Gun is a more advanced level. And we kept the data, and that is the core of my contribution. Of course, there's other things like, from my NASA days, bringing over telementoring, and also from my computer days, doing the first CD-ROMs with interactive simulation with video games. Oh, yeah, I won an award for that at SAGES 1996. I mean, but you see where the core is, guys. It's all around empowerment. By empowering others, you create a legacy, that lasts way beyond your time here on this planet.
I feel like you've just been such an innovator and a pioneer. And I love that you brought up this like telementoring and telemedicine, because I think you had mentioned that you had been doing this since the early 90s, whereas I feel
Oh,
like most of us haven't really known about telemedicine until COVID and the pandemic and just,
right.
the last couple of years. And so I kind of wanted to ask you about that experience, including, being the technical director for NASA, guiding surgeries on Mount Everest. I mean, I just kind of want to pick your brain a little bit about these experiences and, what you think are the most significant advances in this field and how you see its future development impacting surgical practice.
Well, for a long time, and I owe all of this to my when I went to Yale and was professor of surgery at Yale and also the head of Yale laparoscopy. My chief of surgery, he was with NASA and brought the NASA um, um, he brought the NASA tech, all the NASA assets from Houston. He brought there, and we were a special center for NASA in doing all these things. And I really thank him for letting me interface. But early on, I was in a big meeting with NASA in DC, and I knew in my heart, Jenny, this is how we were going to propel, well, have an equalizer. Dr. Merrill that's Ron Merrill, that my chief of surgery. Dr. Merrill has talked about the democracy of healthcare delivery. That was our dream, to democratize that. How do you do that? You do it with telemedicine. So at that particular point in time, we were actually working on how do you operate on somebody with telesurgery on the shuttle. How do you teach someone to be able to do this if they're going to Mars? Because laparoscopy would help you to contain all the blood. I knew that this had a huge possibilities for the public at large, except here's the problem: getting people to pay for it. Uh, Nobody would pay for it. It was all supported with grants, and
You
nothing's wrong
and
with
when
that, Jenny,
and when you
because we
say
were.
when you
Go
say
ahead.
pay for it, is it the equipment, the actual
Well, the
operation,
equipment, but also the
the
services.
services? Yeah.
Now, that's when I wrote my editorial. Several papers, carried my editorial about the blessing of COVID. And you know what the blessing was? They started paying for it.
Yeah,
Because they saw the
until they
importance.
yeah, and then they stopped. Now they don't anymore. So it's back
Yeah,
to
but it's
kind of
coming back.
yeah, yeah,
Because now all the infrastructure went in, all the patients got used to seeing you over the
yeah.
airways. All of a sudden, the equipment costs went down. Everything
Mhm.
that I predicted 25 years ago has now come true. So
So
now
when
the
you were
big thing I wanted it for, for the general public, but I wanted to be a coach over the shoulder, Jenny, of someone starting out to help them during their learning curve. And that's with telementoring. And that's when in 1996 we did the first telementoring demonstration at SAGES. And I still got the video and that sort of thing. So telemedicine is going to become more and more important. Now, here's the thing. There's a protocol. This is not like getting on and just talking to people. That once again, I brought aviation over, and specifically NASA CAPCON operations, the people on the ground who are directing the astronauts. And so there's a formula, and I wrote about that, talked about that, all those protocols, and kind of tried to contribute. And we're still having a hard time with people who see this coming on as, newbies. They don't go back and read. Most of the young people only go back 5 years or 7 years. But it's all in the literature about how you to do this. And that's my goal now, to work hard to help people to do it right.
Yeah, I feel like you're so advanced for your time. I think so many of your ideas that, you had 25 years ago are now just coming to fruition. I think about, robotic surgery and thinking about operating remotely. These are all kind of concepts that it sounds like you were already exploring with other industry, 25 years ago, which is really incredible.
And outside of industry, because connected to that was my work in drones.
Mm.
So 30 years ago, I was using.
Of course, you make drones.
I
I
know.
mean,
What
we
don't
knew.
you
I mean,
make?
Of course you designed drones. We were just like, yeah, we just
We're like,
assumed that
yeah,
you were
someone.
a designer and flyer. And I figured you did use drones to do surgery, Butch. Like that's where I put you based on when I was reading. I'm like, this guy, I mean, again, just
Uh, it, it,
a stratosphere above the rest of us in many regards. So
but for you too, what I want to tell you too, and for the youngsters out there, being like that, it's a magnet for criticism,
sure, yeah,
skepticism,
I'm sure you received a lot of
and,
criticism.
but
Yeah,
endure it.
yeah,
Because if you're
yeah,
blessed long enough to live, or even if you're not, if you're writing and you're contributing, the world eventually come back and say,
yeah,
wow, you know, we could have done this a little earlier if we only looked. So I
yeah.
want to encourage you guys, push
Thank you.
that envelope and push it hard.
Well, that's what Sage is all about in many
Yes.
respects. And I want to pivot a little bit. We got a bunch that we're trying to figure out
Yeah.
what to dig out of you, to get out of you. But one of the things that definitely comes across is, and this ties a little bit in with what you just talked about, doing some telesurgery and telementoring, but also actually going. I mean, you've performed surgery and mentored worldwide. You've traveled. What lessons have you learned from working in various environments? You've had multiple different areas that you've operated even here in the
Oh,
U.S.
oh yeah.
And how do those kind of places that you've gone and environments that you've been into and involved in, how have they influenced your overall approach to healthcare?
Oh, it taught me that we are more alike than different, that there's a nidus of common ground that can grow when you go to another area and you influence them, whether it's in the middle of the Serengeti, or whether it's in the rainforest of Ecuador, or it's in downtown Cleveland or Akron. When that people have a thirst to advance, they really do,
So
Kevin.
both from the trainee side, and I think also at the patient side, right? Like we're
Yes.
so you're talking, it sounds like you're talking about like when you train in those environments, but also the actual patients that you take care of, even if they're speaking multiple different languages, or they have, for the most part, unless they have situs inversus, their gallbladders on the right,
Yeah.
their stomachs on the left, their stuff is in the same place, and they need the same care to get better. Is that right?
You hit the nail on the head. There's so much common ground. And when you go, and also, I'm so glad how SAGES now is reaching out, and we have a whole component that goes internationally, because that goes down to back to the democracy of healthcare provision. And and people think it's hard. Oh my God, you're going there and there's nothing. And it's amazing what you can do without, Kevin and Jenny, and still do well and do good service. You shouldn't let that be a barrier. That's what I learned. That people are willing to, they love they're sponges. They want to know, the doctors there want to know more, and the staff wants to know more. The patients are grateful, okay, and deserve it. So I see that as common ground, and that's why I can encourage people to always try to give back, by being an adventurer and going out there on the frontier to help people. And Sages has organized that so well compared to where we started and where we are now.
No, I love what you said about that. And I totally agree with finding more common ground. And I think as
Yes.
surgeons, we all care about our patients. We just want the best thing for them. And so it's really great to hear that, because I think there are probably a lot of misconceptions we have about operating in other places and doing other
Yeah.
things that probably aren't true, that we can continue to learn from. So that's really great.
And
And
it's amazing, Jenny, when you go ahead and give them that missing link, that little thing that they couldn't get on their own. Like when I actually got Ethicon and Johnson to contribute $600,000 of equipment, to Jamaica, right? No, Jamaica, and then we also introduced the Curacao and Aruba. And do you know, these people took this simple stuff that wasn't the highest technology, And a year later, they're publishing their hundred gallbladders, and they did it so well. I mean, they can do it. We just give them a little help and give them the best of our mind. They will take it and run.
Yeah, I love that. And I think on that theme, we've really picked up on the fact that you're such a social advocate. And so I kind of wanted to ask you a little bit about some specific issues in healthcare that you're the most passionate about, and how do you really advocate for change in those areas?
Well, the diversity, the DEI issue is something that I'm really glad SAGES has embraced, because there's too few Butch Rossers in SAGES,
I
too few
agree.
Butch Rossers in medical school, too few Jennies. Okay, and that has to change. And that has been the biggest target I have now. Not to, replay the past and ask for pity, for you to do this out of pity, but just to do it because it's right. We need all of us, as many of us, pulling together in one position. And we have a long way to go. A couple of the saddest moments I had in SAGES that has inspired me to prosecute this path even more. It was two, actually. In Montreal, remember, we have the party on Friday and everything. And I usually don't get a chance to go because I'm working with the team getting med school ready. And so I came back early with one of my youngsters that was with me. He's a first lieutenant in the Army, and I'm really trying to groom he and others. Well, I was sitting behind the driver's seat, and one of our members came up and started berating me because they had to get back to the hotel right away, and I wasn't doing my job. He thought I was a bus driver.
Oh my
And
gosh.
I had to
So
say to him,
awful.
"I'm sorry, sir, but I'm one of you." And someone in the back said, "You idiot, you don't know who that is? That's Butch Rosser." That was Montreal. Then in Cleveland, okay, I had run over to Top Gun to get some food, and I had my Top Gun gear on, and everything like that. Oh, forgive me, Top Gun gear on. And I had a lady come over to berate me because there wasn't food. She thought I was part of food service.
Mm.
This is why. And then, but thank God, the upside is someone standing on the line said, "Hey, you idiot, you don't know who that is? That's Butch Rosser."
Mm.
See, it's not those people who displayed that kind of behavior that's shining in my mind right now. It was
Mm.
the people that came to my aid.
It's the Mike Brunts in the
Standards.
crowd.
You see what I'm
Yeah.
saying? All of a
The Mike,
sudden,
you
we go
see
back.
Mike
Now,
Brunt. You see Mike Brunt back when you're in chemistry, right? Was it?
right. Mike helped because he put that, he embraced me. That helped me have hope that I could make it. Now, the bad thing about it is it was a sad time because my youngsters were with me, especially African American males. They said, "Dr. Rosser, all you've done, and look how you're treated. Why am I
So
doing this?" That
disheartening.
was their big
Yeah.
Mm.
question.
Yeah.
Why am I
Mm.
doing this if they're going to
Mm.
treat you like this?
Mm.
You.
Yeah.
And I said, "You know what? You're doing it because, just like my daddy told me, you're not doing this for yourself. You're carrying a whole race on your shoulders.
Mm.
And you got to have wide shoulders and big feet to lead." And that's why DEI, I'm trying to get people to know we have to do more. We have to aggressively recruit more African Americans, especially African American males. I was on television speaking about African American males in medicine, uh, and a species on the verge of extinction.
Yeah.
We're
The
having fewer and
data's
fewer.
not. Yeah. The data's not great for
It's not
matriculation.
great, and
Yeah.
I write on those things now.
Yeah.
And because I think I have to.
Mm.
I do programs on those things now, because I have to, not to rub it in anybody's face, but let people know we have a way to go and we can do it.
Yeah.
Sure.
Build a path for those coming forward. and a path to the future.
That's
Yeah.
right. And I know you're in the middle of this, Jenny. You're on the committee and this sort of thing. And I know this year I got invited to be on the committee, and I think I'll be on the committee with you. So I'm
Oh,
also sharing.
DLPD, welcome. DLPD, welcome.
Yeah, I
All
think,
right.
yeah,
This is a
yeah.
committee moment. We have a committee
Yeah,
moment. You guys
exactly.
can,
That's
this is
great.
the
I love it.
DLPD committee. Jenny
Yeah.
can, that's
Yeah.
awesome.
Yeah. So that's what's driving me now. Hey, but I'm a terminal 12-year-old, so there's always something driving. My wife said, "You think you're 25, and I'm here to inform you that you're not." All right.
You're like, I know, I'm 26.
Exactly.
I know I'm not 25, I'm 26.
Kevin, see, you know me, Kevin.
I know
You
you.
feel
I know.
me.
Just,
You
yeah,
feel me.
Yeah.
No, I love your vision, and I love the inspiration behind all the things that you do. I think in this day and age, it's something that we really need to hear more of. And I think that's really inspiring. So I really do hope for the people listening to this podcast that, we can make it, and that there is light at the end of the tunnel,
Oh, yeah.
and that there's so much more that we can still do. And I think, the future is something that we're all going to try to build together. So
Right.
I'm
Exactly.
excited.
Together. And for me, it's all about that love affair that started way back in 1993 with SAGES. Through hard times, through good times, it's still burning with a deep, with a very aggressive flame. And even though, like I said, I could be both of your fathers, I share that youthful enthusiasm that you all exhibit every day. And I try to have that infectious nature transferred to others. And that's why I have a big smile when you see me, and a hug
Yeah. No,
when you
that's
see
one
me.
thing I will say, if I've ever I've seen you many, many times over the years. And if there's one thing anyone would know about you, that is you're going to see a huge smile when you see
Yeah,
Butch
yeah.
Rosser. And
It's a
so
pleasure.
as kind of disheartened as I think you made me and Jenny and everyone who's listened feel about those two tough experiences, you did follow it up with some redemption behind it. But I think another thing we want to kind of push you to do is, and you probably heard a couple of these podcasts, is one of our favorite segments is the We Are the Sages segment.
We are the world. We are the world. We are the sages. We are the sages. Sing it, everybody. We are the ones who make it bright our day. So let's start treating. Have you had a good time tonight? There's a choice we make. We got a lot more coming. We are dancing.
Oh, okay.
And for this segment, we actually want to hear about your most memorable Sages moment.
Oh,
And
wow.
it's a safe podcast. I think you've stretched the limit a little bit with it, but it's rated safe. But feel free to stretch it a little bit there, Butch.
No, it's a good look. That's a good question, because I think through that question you get a real true picture of the background in SAGES and how I feel about SAGES. I think, wow, there's been a lot, man. I think,
You can share too, since you've been in SAGES for so long.
yeah,
You can take some license to share too.
there there are two times when I gave one of the named lectures,
Oh wow, okay.
and I think it was a Carl Storz lecture. Forgive me about that. It was 2012, I think. That was a big thing for SAGES to acknowledge me to do that, because you rarely saw people of color, and much to my dismay, and we can have some cattiness, within, how surgeons are, we are, and I think I've always been kind of misunderstood because I don't fit the I don't fit the how can I say, the projection of a surgeon. I'm not 6 foot with a size 42 coat. You know what I mean? I mean, that's just not me. And
We would say you're
it was
larger than
tough.
life in many respects, Butch. I
Yes,
think
and most people were concerned, because if I walk in a room, the air kind of gets sucked up, and that can be intimidating.
Sure.
And when they did that, I said, wow, maybe people are now comfortable with Butch being Butch. And that was and it wasn't the plaque or whatever like that. It was the recognition, and deeper than that, well, maybe they are finally comfortable with me.
Well, I think that's what we're here for, right? Is to challenge some of those preconceived
Yeah,
notions of who is a surgeon and what a surgeon should look like and what success in surgery looks like.
yeah,
And so I'm really glad that you've been there as a role model sort of throughout all of that. So I think
yeah.
that's really uniquely important. Yeah.
And it took a while. But some people say, "Why aren't you bitter?" No. And the second moment is when I was recognized to actually go to the board, when Stevie Sweisberg and Dan Jones, DJ, they recommended me for the board. And I would say there's a whole lot of moments, but those two moments said to me that maybe I've accomplished what I've wanted to accomplish, where, you know, well, he's Butch Rosser, and it's okay. So I share these little things with you. And some people are, well, why doesn't he just stick to talking about surgery? Because I'm more than surgery. Jenny, you're more than surgery. Kevin, you're more than surgery. I think surgeons would be better off if they could get in contact with their inner selves more, instead of the facade of what we should be, as surgeons, and how we walk and how we talk and what we laugh at. We're human beings, man.
Yeah. I
That's
think you bring
awesome.
up this really interesting concept of authenticity, right? I think we talk a little bit about that a little bit more now in self-expression and how do you do that as a surgeon, especially if maybe you're not what people traditionally think of as a surgeon, and how do you break those molds? And so I think we're definitely seeing more and more of that now. And I think
Yeah.
people are more appreciated for their authentic selves. And I hope that that's a way for people to kind of continue to move forward and to stay true to their passions. I think that's how, you get all of these amazing things that you've done. And honestly, like, I think, as we wrap up, one other question I really wanted to ask you is, you're such, I think, a forward thinker, and just, wearing your futuristic hat, what do you sort of envision for the future of surgery in the next decade? I want to pick your brain a little bit and see, how do you see technology influencing surgical procedures and patient outcomes? Like, what do you see for us in the next 20 to 30 years?
Early on, I was a technocrat. Okay. During my early years, and it's all about leveraging technology. But I think our biggest challenge, and I'm not the first one to acknowledge it, is how do we get our patients engaged, and how we actually democratize, healthcare delivery. That's our challenge, because the tech is going to take care of itself. But if you don't deliver it to everybody, we haven't done a thing. I see AI is going to help us considerably if we use it right to be more intimately involved with our patients. Because the big thing we talk about when you go not from surgery, but just in medicine in general with the big think tanks, how do you get patients to give a damn about themselves? How do you get them to participate? I see AI and other computer-driven things thinning the interface between the patients and ourselves, getting them to do things exactly like we want, getting them prepared for surgery, and then helping us to have great outcomes. See, there are great outcomes in doing the surgery, but there are great outcomes in getting patients to prepare well, help you to assist you not to have errors. Because let's be honest with you now, we have a lot of pre-op errors that lead to post-op complications where standards aren't kept. And I know that's a little different than you may get from other people. They'll talk about, oh yeah, robotic surgery and remote control surgery and all that. But I'm going to step back and tell you that it's all about leveraging technology to thin the interface between you and the people you serve, so we can master consistently great outcomes.
Yeah, I love what you said about that. And I think about, all the things that have been put in place, even in our medical records, where it'll flag
Right.
you if you say, oh, did you look at this for this particular patient? Did you consider their VTE history? And so I think all of these automated systems are starting to exist already. And what you're saying about sort of integrating that into care so we can consistently deliver a standard of care sort of
Yes.
regardless of where you are, and to create more equity, right?
Yeah,
Among
exactly.
healthcare
That's
delivery.
our goal, Jenny. That's our goal, really. I could talk. Look, I can sit here and talk about all the think tank stuff on helping us to execute the procedures. But you know what? At this time in my life, I think I have to go to where rubber actually meets the road, and because we need to do all those things. Don't get me wrong, but we need to also concentrate on this thing. So. So
Yeah.
it's been great. But I can't go without we talking about the next generation. You talked about authenticity and I talked about being yourself. And the other reason we're doing that, to inspire these kids to want to do what we do. That's
Oh yeah, for sure.
listen, when
Yeah, it's
they
a
see
great
me,
job.
yes,
It is a
right.
great job. I love it, and I agree with you. I see fewer and fewer people that I think would be fantastic surgeons, physicians wanting to do it.
Yeah.
And I agree with you. We need to inspire the next generation. There's no doubt about it.
And
Otherwise,
that's why many med
otherwise
schools.
we will have to keep working.
Oh, look, I'm still working. I just got an operating room.
I know. I look at you. You're just you. My dad's 77, still operating. He went to ACS with me last.
Because he has
Because
to.
he had to. Because like, who else is going to do this, Kevin?
That's exactly right. But guys, I want to put the focus on the mini med school. That was a proud moment when just they trusted me with that back in 2012. I've been doing it with the college since '96, but SAGES trusted me in 2012. Now it's growing, and now I've had this Top Gun surgeon squadron where the kids have a place to go every Sunday, getting their names on papers, their names on books, helping other kids. And that's what it's all about. And the thing they always say, Dr. Rosser, you still a big kid. And that's not a bad thing. They just think, you mean I can stay like I am now? I don't have to change to be a doctor? I say, yeah, girl. And at Yale, it was really, they had to get used to me because I roll up with my Escalade with DMX, playing, and then my baseball cap turned backwards. They did not know what to do with
They
me.
didn't know what to do with you.
That.
New Haven. That's not
it.
not a look that's common in New Haven.
No, it was not with a surgeon.
Not with a surgeon.
But they got used to Butch being Butch, and I had these kids flocking to me, and that's what I'm doing. I mean, I'm doing that diversity and inspiring the next generation of kids.
Yeah, I love that, honestly. And I think that ties in so well with some of the themes that you sort of started our podcast with, right? Talking about, your parents, the era that you grew up in, and how that really influenced you. And honestly, it's like such an incredible story. I honestly wish we had all night to kind of sit here and, talk to you and hear about your experiences. But, I think we're going to have to wrap up as we're reaching the end of our time together. But I know I kind of said this before we started recording. I really think you may be the running for the most interesting man alive. I just see all your accomplishments. It's really incredible. So, unfortunately, I think we're running out of time. So Kevin and I will try to kind of catch up with you and tackle some more of these stories when we see you soon at the SAGES annual meeting in Long Beach, California. Yeah, so hopefully
and
we'll
plus,
see
you all
there.
have just inspired me by doing this, and I'll end on this. Yeah, I have my memoirs called "Chopping the Tough Row." You just inspired me to start back on it.
Good.
This
Yeah, get going on
I
it.
can't wait to read it.
to try to get, because I realized, I said, oh my God, you've been through a lot of stuff.
You have been through a lot of stuff.
Well, God bless you all, and having youngsters like yourselves in leadership positions and doing this podcast to bring out nuances that no one would ever really realize. Hey, you guys doing a great job. And I hope we could do that history of laparoscopic surgery one.
Yeah,
myself,
we got a good,
Dr. Green, Dr. Schweisberg, and others. You need about 4 giants, who can tell you the skinny on what went on behind the
Yeah.
scenes and in front of the scenes.
That's a great idea.
That's a
God
great
bless you
idea. We're gonna have to reach out to you to plan it.
Oh no, I'm serious. That would be one of the most watched podcasts of all times. Well, God bless you guys, and appreciate all you all do for SAGES, and look forward to working with you all some more.
Thank you so much, Butch.
All right, God
Have a
bless
great
you.
night.
All right, bye-bye.
Thank you.
Night.
Yeah.
And so I guess for all of our other SAGES listeners, just a reminder that the annual SAGES meeting will be in Long Beach, California, March 12th to 15th, 2025. We can't wait to see all of your submissions and all the work that you've done this past year. More importantly, we're really excited to see so many friends again. So make sure you block off those dates for your calendar as it starts to fill up for 2025. And with that, Kevin and I want to thank you, Butch, for a great SAGES Stories episode, and we'll see you next time.
Awesome. Good job. And that wraps up today's episode of SAGES Stories. You can view the show notes for any links to sites we referenced today. Visit sages.org for membership information and for the most recent news from our society. Follow us on Twitter at @sages_updates. Make sure you hit the like button and subscribe so you don't miss any future episodes. See you again next time, and remember, you can't spell minimally invasive surgery without SAGES.